About 62% of pneumonia cases have no known pathogen when they look at it, and that pathogen means no known bug as to what's causing it. A number of cases are viral in nature, and then a number of cases are bacterial in nature as well. So because of the different types of pneumonia, we can catch this usually via a respiratory droplet. And this is going to be a respiratory illness that is being around others who are sick. So we want to make sure during our time in flu season, and then just in general, we should be washing our hands, especially before we're going to be touching our face, and especially before we eat. How can I tell the difference between having the common cold or having our COVID-19 virus or the flu or pneumonia? And all of these tend to group together. Pneumonia will frequently occur with a fever and chills and body aches and that whole body illness, the systemic symptoms. Whereas the common cold frequently comes with more upper respiratory symptoms, so sneezing, runny nose, headache. And so we see this pneumonia being the whole body picture. And so if you start developing some of these symptoms, the fever, the headache, the chills, that might be more of a sign of pneumonia and requiring to go see a doctor within a sooner amount of time. There's always a possibility that the people around you might not be showing symptoms. So they might have some sort of bug and they just don't know it yet, or they haven't developed the symptoms. And that might be where we're catching our pneumonia pathogens. And so we might get sick from people we don't even know have any sort of respiratory symptoms at all. We'll frequently see pneumonia all year long, but it does seem to increase in numbers around the same time as influenza during the fall and winter months. This is commonly thought that as people spend more time inside, they are avoiding the cold weather. They're going to be coming together in groups, especially around the holiday season, that these germs tend to spread a little bit easier. Pneumonia vaccine, right now we do recommend that Prevnar 20 is the current recommendation for all adults 65 and older, and adults from the ages of 19 and 64 with certain comorbidities, so certain underlying medical conditions. It exposes your body to what your immune system is going to respond to for pneumonia should you encounter this out in the wild. So the Prevnar 20 right now is a one and done. We're using this because it can attack different strains of pneumonia. And so by using this multiple valent vaccine, it's helping to protect us from different strains. You certainly can have pneumonia and the common cold. We've definitely seen people with an upper respiratory illness, and then for one reason or another, we get a chest x-ray or we evaluate, and then it turns out the patient does have pneumonia and they have this corresponding symptoms of upper respiratory illness as well. Most common colds are viral in nature and don't require any sort of intervention aside from symptomatic treatment. So buying some of those medications over the counter for the flu and the cold, those are usually the treatment and go-to choice for any common cold illnesses, whereas pneumonia will usually reach towards an antibiotic for treatment. A lot of people can pass through pneumonia on their own. So sometimes these viruses or these bacterial infections, your body can pass through. The immune system is pretty powerful. However, some people can't pass these and they continue to get worse. So we can see a lot of mortality as a result of these infections, especially in our patients who are over 65 or with underlying respiratory illnesses like asthma or COPD. So if we get these infections and don't take action, we don't take care of them, these can allow patients to get really sick really quickly.